Doctor, is flu season already on your radar?
Absolutely. We've been watching influenza cases. There's a little bit more activity this year than we've seen over the past few years. So we really are worried that without public health interventions like we had last fall, that we're going to see a surge of flu cases, and that's going to complicate COVID-19 diagnostics. And it's also a disease that may target younger populations more because we haven't seen flu in a few years. So it's a complicating issue that we're really keeping an eye on while we keep focused on COVID-19.
All right. So, Andy, as we get focused on trying to get more people vaccinated, there was some news that crossed, including the Pope urging everyone to get a COVID vaccine and the White House making a call to Nicki Minaj after her Twitter post that got a lot of attention that we wouldn't read because it wasn't really fit for morning television. Is this the way to get more people vaccinated?
We have to really go out there and aggressively go after the misinformation and the lack of information. And then we also have to find better ways to communicate to the pockets of population that are probably willing to take the vaccine, but are really just step back and see all of this noise on both sides and are just unclear as to where to go. The science is clear, the safety is clear, the efficacy is clear. Just got to get better at getting the messages deliver correctly to the right populations.
Andy, when you're talking about all the things that are clear, to your point, there's a lot that's unclear, and I think about the booster issue, in particular the FDA meeting for an extensive period today to discuss whether to recommend boosters. Do you think that this debate is premature and muddies the water, or do you think it's important for us to be focusing on this because it will be an important tool?
Well, when it comes to boosters, the one thing that is clear is that the data on boosters say that boosters are safe and boosters do increase the amount of protective antibodies that you have in your system. So no doubt about the safety and efficacy of a booster. What's really in question is the need and the priority of individuals to get a booster. We have to think about this as boosters are going to help reduce severe disease. So if we focus on populations that are vaccinated but starting to see some more severe disease, and the over 65 population is one of those, boosters may be perfectly reasonable for that population, but boosters are not going to help reduce the number of cases in this country because that's driven not by vaccinated people, but by unvaccinated people getting infected.